This is The Broken Shift with Nurse Natalie. Healthcare doesn't break in chaos, it breaks quietly. I read a story recently and I felt it immediately. A nurse had been assaulted. Less than 48 hours later, she needed a forensic exam. But the only hospital that could do it was the one she worked at. And she had to make a decision rather quickly. She needed to get care or protect her privacy. Like, that's the decision she was making. So let me ask you something. Would you feel safe becoming a patient where you work? I came across a post from a nurse in a small town. She needed a SANE exam. That is a sexual assault nurse exam. But the only trained forensic nurse was at their hospital, or the one that she worked at, her workplace, where her coworkers would see her name, her chart, and her reason for being there. And the next closest option, 3.5 hours away. Now, this is huge, especially now with hospitals closing. What would you do in a situation like that? Because we are seeing hospitals close, and then keeping your personal information private is really tough. And when I read this, I didn't just feel bad for her, I recognized it, because this isn't rare. This is something nurses deal with more than people realize. How many nurses are walking around with health issues that they're avoiding addressing because of where they work? Because maybe the only access to care they have is where they work. There are nurses who delay care, ignore symptoms, avoid testing, put things off longer than they should. Not because they don't understand the risk. Obviously, they do. But because they understand the system. They know who might see their chart, who might recognize their name, and who might start asking questions, even if no one says anything out loud. The exposure is still there. We say, your privacy is protected, right? And legally, yes, it is. But emotionally, socially, professionally, that's a different story. Do you think there's a difference between legal privacy and real life privacy? Because I do. I honestly think there's a difference. And then there's another layer that doesn't get talked about enough. Time off. Because let's be honest, healthcare culture does not always respond well to absence, especially when units are short-staffed. So now the fear becomes, will people question why I'm out? Will this affect how I'm scheduled? And will this impact my reputation? Will there be subtle retaliation? Not always direct, but enough to make people think twice. It's a lot to think about when you're the healthcare provider needing the healthcare. Have you ever hesitated to call out even when you needed to? I'm sure many of us have. So now this nurse is not just dealing with trauma, she's navigating privacy, workplace exposure, time off concerns, long-term perception, all while needing urgent care. That's an impossible position to be in. And this is where the real issue is. Healthcare is designed to care for patients. Yes, it is. But when healthcare workers become patients, the system doesn't always protect them. There are very few options for anonymous care. alternate pathways, protected staff treatment, especially in smaller communities. If you live in a large community, you might be able to go from one big hospital to another, but in smaller communities, there's no backup system in small towns. No second hospital, no alternate provider. Your workplace is your only option. And that turns access into exposure. This is bigger than one nurse. It raises a real question. What options do healthcare workers actually have when they don't feel safe seeking care where they work? Because right now, those options are limited. And this creates something deeper. If nurses, people who understand the system, don't feel safe using it, what does that say about the system as a whole? No nurse should have to choose between getting care and protecting their dignity. No healthcare provider should have to, as a matter of fact. Do you think healthcare systems are doing enough to protect their own staff? I want to hear your thoughts on this one. This is The Broken Shift. I will see you in the next one. Healthcare culture doesn't change when we ignore it. It changes when we're willing to examine it. This is The Broken Shift.